So in a follow-up study, we are going to have several interim analyses, one at year 1. So when everybody reaches 1 year of follow-up, we are going to look whether there is a primary endpoint met. Also, we are going to look the changes in brain volumes respect to changes in cognitive outcomes. That will be looked also at year 2, and the final analysis will be done at year 3. But the study also has other outcomes, including serum-based biomarkers like NFL and GFAP and some others, as well as patient-related outcomes. There are also high-resolution and low-resolution imaging outcomes that are comparing in a multicenter study how those work to each other, specifically a 5-flare approach that is working on a low-resolution scan outcomes to a high-resolution approach like 3DT1, volumetric imaging, etc. We are also doing a cervical volume and comparing medulla oblongata with cervical atrophy as a proxy. So there is plenty really of outcomes that will be explored, and ultimately what's predicting cognitive decline in early patients with MS. And obviously whether Ozanimod or Zeposia can modify it. Certainly, we would like to do more baseline sub-analysis because obviously all these people didn't have the same age, right? And didn't have the same lesion burden. So I would say that in this group of patients, there is certainly variation respect to cognitive decline related to age, disease duration, and amount of lesion burden. I would probably allow, if I would go back, allow a little bit longer disease duration. I think that we were pretty restrictive, which kind of really slowed down the enrollment in this study. But you know, at the end, this will be a unique study because no other study really looked on such a unique cohort of early patients with multiple sclerosis. So it's questionable whether anything should have been changed. You know, we just confirmed the other data that even in this almost onset population, there is already 20% of the patients have a cognitive impairment. So I think that what should be brought into conversation at the patients at the first even clinical diagnostic visit is cognitive impairment in MS, and how this is just the beginning, right? And how important is to choose the treatments that can delay or slow down cognitive progression. I think that's the most important message that I have.